In this video, we are going to talk about malaria in the Democratic Republic of Congo. We will be discussing about social determinants of health and health promotion regarding malaria.
Ow! Sorry, there was a mosquito on you. Oh, no doubt. I mean, I wouldn't want to get malaria. We're pretty low risk here in Canada. Nothing like the Democratic Republic of Congo.
Congo? Where's that?
Oh, I'm glad you asked.
The Democratic Republic of Congo is the second largest country in Africa. It is the home to the oldest national park in Africa, the Virunga National Park, where you will find all kinds of animals including gorilla, elephants, and lions.
The capital city is Kinshasa, which lies on the banks of the Congo River, one of the longest rivers in the world. The DRC is considered to have the richest supply of untapped minerals in the world, up to $24 trillion. I'm talking oil, gold, copper, and the list goes on. Not that they are able to tap into these resources. I mean, with a corrupt government leading to dysfunction of the healthcare system, lack of proper education leading to low literacy, lack of proper infrastructures such as roads and electricity, war, extreme poverty, poor hygiene, large household size in a small home, poor water quality, and so on.
These are known as social determinants of health, and these are all things that leads to DRC having the second largest number of malaria cases and deaths in the world.
What exactly is malaria?
I can answer that. Malaria is caused by a parasite.
A parasite is like a tiny bug that lives in your body that would need to get all of its basics for survival from use, such as food and protection. This parasite is transmitted through a female mosquito that has recently taken blood from a person infected by malaria. 10 to 15 days after being bit, symptoms start to show, starting with a fever, an increase in your body temperature, headaches, and chills. If not treated quickly, it can become a serious illness that can lead to death.
Pregnant women, children under the age of 5, and older populations are more vulnerable to malaria. They are the high-risk population. In Congo, around 200 children a day die due to malaria.
It spreads easily with stagnant water. Stagnant water is where the female mosquito lays eggs and the mosquito population grows. With poor infrastructure in the Congo, stagnant water is common. Sadly, the corrupt government doesn't help this either, as they don't work to fix this problem.
What treatments are there then?
We know that hydroxychloroquine, a fancy name for a medication, is a good treatment.
And if someone does get malaria, they need to go to the hospital. But with the dysfunctional healthcare system in Congo, it's hard for people to access that treatment.
The thing with malaria is it is better to prevent than treat. Insecticide-treated mosquito nets are very useful to prevent bites, but make sure the nets don't have any holes. Have screens on the doors and windows to the house to prevent mosquitoes from entering. Any water containers near the home should be covered. Mosquitoes are attracted to light-colored clothing, so be sure to wear dark colors and long sleeves and long pants.
We should minimize going out at nights, as mosquitoes are most active at night. We should especially care about our own hygiene and sanitation. And health promotion should be taught in schools, seminars, surveys to address malaria with empowerment.
The people of the Democratic Republic of Congo need their government to take charge. With proper government, there would be better opportunities for education and a decrease in poverty. This would improve overall health. The government could also improve infrastructure to make roads that were safe to travel. This would make it easier to access health care if someone was sick. With a strong government, they could also improve the healthcare system.
The World Health Organization is promoting treatment for the high-risk populations such as pregnant women and children. They identify threats to malaria and control them. They focus on the government and their willingness to reduce the risk of malaria, working to eradicate it. They believe that no one should die from a disease that can be prevented and diagnosed.
Okay, so let's summarize. Malaria is a disease that is a big problem in the DRC. The high-risk populations are pregnant women, children, and elderly. There is poor health in the DRC, which is a result of corrupt government, which leads to dysfunction of the healthcare system, lack of proper education, lack of proper infrastructures such as roads and electricity, war, extreme poverty, poor hygiene, and poor water quality. To prevent malaria, wear long dark clothing, use mosquito nets, cover stagnant water, and remember, if you ever have fevers, chills, or headaches, consult with the healthcare provider. If malaria is not treated with time, it can be fatal. The WHO is hard at work to eliminate the disease.
Let's get rid of malaria by working as a community, supporting each other for better outcomes.
Everybody deserves equal access to healthcare.